Hello, class. Welcome to Nursing 302 Final Exam Review. I first want to apologize. I've had such a traumatic experience where I am not able to connect to the internet in Dubai, so I wasn't able to start this until now. I had a computer geek with me, and she was able to come up with this idea of putting it on YouTube. So I'm first going to do a 20-minute overview, and then I'm sorry, 30 minutes overview, and then I'm going to do another 30 minutes after we get settled. So I first want to start with the final exam and some of the things that will be on there. When we talk about ethical principles for protecting student or for protecting the sample size or the person taking part, we call them the participant. We have to be always ethical. And so just understand the term, what beneficiary mean, what respect for human dignity means, and what justice is. Alrighty? So if you know those terms, you should be fine. Justice, the key word is fairness. Okay? And of course, respect is respect for human dignity. That means we have to provide confidentiality. We can't talk about their research to anyone. And the next one is beneficiary. Beneficiary is the process by which you will cause no harm. So if you know something is going to cause more harm than it should, we would have to reconsider that. The organization that takes care of all of these ethical concerns is called the IRB, and that's the organization that protects human subjects. Alrighty. Remember the two types of research. We talked about those at length. We have qualitative and we have quantitative. Qualitative, of course, is the feeling research. The keywords that's going to direct you to what is a qualitative research is human sensitivities or human feelings. The word that you will look for is behavior, is feelings. All of those words is going to direct you into the emotionality of qualitative research. And of course, quantitative, although it just has one or two words to define it, it is the one that deal with numerical data and status. So there has to be some statistical implication that will gather some numbers. Now you might ask, well, doesn't qualitative have numerical statistics? Yes, it is. At times, we might have to use quantitative information to describe some of the quantitative. So one of the things that you might see in a qualitative research is that they will have what is called the name of the patient, the age of the patient, all of those things that will help us to describe the data set. All right? And that's very important. The next part that you must know is that what is a problem statement? What is the statement of purpose? So a problem statement is one that gives you, okay, let's start over. We can never do research without knowing a problem, okay? So you have to always know what the problem is. If you have no problem, what's the use in doing a research? So you must know the problem. The way in which we talk about the problem is how we put it in a statement. So we must know the statement of the purpose. Why? These are the why questions. Why do you want to learn it? Okay? Why is it important to society? Why is it important to the students, to the patients, for example? All right? Then the next thing that we must do is we must put it in a question. So most questions or all questions will be asking a question. So a purpose statement is not a question. And this is where a lot of students get this wrong. So the question of a research will always ask, what is the effects of? How does this implement will cause a change? So you're asking a question. The key that I always tell people, if you don't see a question mark, it's not a question. Okay? So you have to have a question. There's something that you must know that's called a hypothesis. Alrighty? And that is only in quantitative research. And the hypothesis is where we will utilize the information for testing. So we have to test the hypothesis to see if we get a null hypothesis or if we get an alternative hypothesis. Remember, a null hypothesis clearly state that there's no difference between A and B. An alternative hypothesis means that there is a statistically significant difference between A and B. Now you had a paper to do, or whatever you want to call it, that helps us to understand why is it so important to critically appraise the research. And it goes through the whole research, the problem, the question, and the hypothesis. Alrighty? So that is why you're doing the critical appraisal of research, to understand how they line up together, to understand how you would critique a hypothesis, how you would critique a research question. Alrighty? I made notes, but I think I don't have to do all of that. Another thing, I left my template. I can't get on my computer, so I don't know the templates. Make sure you know theories, models, framework. Alrighty? The theories is the idea of doing something based on theoretical construct or concepts. A theoretical model is what we talked about in class. It is giving you, if this happened, then this will happen. We also call those models algorithms. It keeps us informed of the decisions that we make to describe a theoretical study. Remember, they have theories and conceptual models. Theoretical models are based on theories. Conceptual definition is based on concept. Keyword, concept. In order for us to understand the different types of design, we have to know what category of structure that these belong in. So we have several different types of quantitative design. One of them is experimental. Experimental is the highest form of research that there is. And the reason for that is because it has what? Large sample size. It has three things that I've said over and over and over again. It is controlled, it is randomized, and it is manipulated. If you don't have those three things, then guess what? We will not be able to call it experimental research, because only our experimental research has those characteristics. Under the experimental research, there are other types of research. We have one very famous one that's called quasi-experimental. Now, quasi-experimental looks like an experimental design, feels like an experimental design, but it's a phony. It is not real, okay? It is missing one of those three criteria that I just mentioned. So either it has control, or it doesn't, or manipulation, or it doesn't. All right, so one of those three things will be missing. So that's why we get the name quasi-experimental design, because it's missing either randomizing, manipulating, and control. It can provide some really, really helpful outcomes if done correctly. There are about seven different types of quasi-experimental design. All right? Then when we talk about the non-experimental research, then we are talking about research design such as comparative, descriptive, and so many more. I didn't write it on my notes, but there's so many more. Observational. All of those are considered non-experimental designs. Observation, comparative, descriptive, historical, and it goes on and on. There's so many. If you know what you should know, then you will always know what is a non-experimental research. And the key thing why these studies are non-experimental, they don't have those three criteria, right? They don't have a control, or they don't have a randomized, or they don't have what? Manipulation.